What is the world's number one threat to life? The world is battling a new problem. We are now trying to wage a war on antibiotic-resistant bacteria. The World Health Organization has said that antibiotic resistance is now one of the biggest threats to global health, food security, and development today. Paul McDermott, a world-leading microbiologist specialising in waterborne pathogens, advises, "It is commonly recognised that water outlets such as taps and showers can harbour harmful bacteria and can easily transmit this to vulnerable patients. So hand wash stations and showers now need to be treated as medical devices rather than just sanitary ware." Deadly pathogens can be present within all potable water systems, and where these are being introduced to immunocompromised people, they can lead to very serious illness and often death. How does that look with a real hospital example? According to the latest NHS figures, at least 4% of all patients will contract an HCAI, with 1 in 10 dying as a direct result of this illness. The current average cost per hospital attempting to control the spread of waterborne pathogens is over £1.8 million. But this cost is insignificant when compared to the costs involved with looking after and treating those who have contracted a nosocomial infection. This example shown was based on published figures by the NHS. The average stay for an inpatient is 2 to 3 days, but increases to 21 days when a patient contracts an HCAI. This costs the NHS on average £38 million per hospital per year, and once medication and litigation costs are included, this figure rises to £39 million. It is clear to see why a solution is required urgently. Many of the problems that need to be resolved have now been identified and are now contained within the Department of Health and HSC guidance. These include splashing from clinical basins, which can contaminate everything around them, sometimes up to as much as 2 metres away. Placement of objects on basins, which can lead to spread of infection through contamination. With current waste systems, the bacteria from within the trap can travel upwards through the sink, caused by positive or negative pressure held within the system. This can then contaminate the surrounding area when the contents of the trap are discharged into the basin, causing the pathogens to be spread through splashing. As prohibited liquids and solids are often poured into the sink, it creates a dangerous food source for bacteria and facilitates growth of pathogens. This can also lead to sinks blocking, increasing risk of splashing. Traditional thermostatic mixing valves contain complex waterways and many plastic parts, which can lead to possible biofilm buildup. Traditional IPS panels can provide areas where bacteria can collect and grow. Taps, soap, and hand gel dispensers often must be touched to be used, creating many opportunities for biofilm to grow. In taps and showers and adjacent pipework, you can frequently find biofilm through retrograde contamination, which can contain harmful pathogens. At present, water testing is a best guess as to which outlets are contaminated. Currently, hospitals are having to pay staff to manually flush taps to ensure water remains moving around the system to eliminate dead legs. Hospitals cannot easily provide targeted chemical disinfection or thermal flushing at point of use, often needing to dose the entire water system. Medical or plastic filters in taps and showers are often areas where biofilm builds up. Monitoring of hot and cold water temperatures is an essential part of good system management, and often this is done in a sporadic and manual process. Auditing of cleaning can be extremely challenging, with cross-contamination of cloths being a common occurrence. Accurate data on all aspects of the potable water system can not only be difficult, but also costly to collect. Hand washing percentages are often below 40%, which only exacerbates the issue with spreading pathogens. Until now, these problems have been almost impossible to resolve. Introducing Angel Guard, the world's first fully automated sanitary medical device with AI capabilities. The unique design of our basin reduces splashing considerably, preventing cross-contamination and placement of objects on the sink. The Angel Guard waste is specially designed to prevent bacterial growth and helps prevent upward travels of water and solids due to positive-negative pressure and can automatically be chemically disinfected. Our unique tap cannot discharge directly into the waste due to its special design and positioning. As our waste aperture is larger than normal, it allows items to travel directly into the sewers. Angel Guard also uses a unique hygienic mixing valve, which provides all the benefits of a thermostatic mixing valve but delivers the water in a safer way, opting to use simple waterways over complex ones. After doing extensive research, Angel Guard has created our unit with materials proven to be the most resistant to bacteria, using predominantly glass and copper, which provides a naturally antimicrobial surface. Angel Guard also has contact-free delivery of soap, water and hand gel, without the use of solenoid valves, along with a biofilm sensor within the tap spout, as well as the hot and cold water pipes prior to the tap. Angel Guard units monitor and risk assess 24 hours a day, 7 days a week, and can identify when biofilm has become present within these areas and creates appropriate alerts in line with how severe the infection is. Angel Guard units provide intelligent information to allow targeted water testing when there may be a heightened risk. Angel Guard provides strategic automatic flushing when units decide flushing is necessary. Angel Guard can automatically deploy thermal or chemical disinfection when required due to our intelligent hygiene system. The Angel Guard system has no small metal or plastic filters, but instead uses high-capacity Paul medical filters proven to remove the pathogen Cryptosporidium. Angel Guard monitors hot, cold, and mixed water temperatures, as well as frequency of flow and other critical aspects, all stored to give an ongoing, real-time risk assessment, creating alerts and deploying countermeasures when required. Angel Guard provides our cleaning protection system, which records who's cleaning each unit, when they started and finished, and a system capable of detecting when cloths have been used to clean more than one unit. It is also able to detect when items have been discharged into the waste and can identify persons responsible for retraining. Angel Guard units collate and provide data in all aspects of the system at point of use, allowing real-time reports and historic information to be displayed in a user-friendly format, with reports able to be tailored for specific groups, including estate management, authorising engineers, infection control specialists, and water safety groups. Angel Guard units have an infection prevention hygiene system, both guiding the user through the animated hand washing procedures and timings, whilst allowing full monitoring and reporting of hand washing percentages, which can provide reports at different levels, right down to individuals and their hand washing behaviours. Angel Guard holds all information in a highly secure, closed and encrypted environment, meaning only you will have access to your data and no one else. Angel Guard units, through their unique colony technology, can risk assess individually and as a cluster of units, learning from each other. For example, which countermeasure would be most effective at this precise time and in this section of the building. Angel Guard units can be provided with point-of-use, pro-economy, copper, silver ionization systems built in, which can help reduce pathogen levels within the water. In addition to saving lives, Angel Guard can also deliver significant cost savings. As shown in our example earlier, the average cost of HCAIs to the average hospital is approximately £41 million. However, if they installed Angel Guard units instead of their current installations, they could save around £39 million a year per hospital, and potentially save over 70,000 lives each year in England alone. As you can see, the Angel Guard unit is truly a world first, bringing a genuine step change in the battle against waterborne pathogens, and in turn protecting and saving the lives of the world's most vulnerable patients. But we do not believe that this is enough, because here at Angel Guard, we are treating our unit as a medical device, meaning the way we manufacture, transport and install the unit will be completely different. Taps, showers and wash basins are often contaminated with pathogens prior to installation due to an unclean manufacturing process, with testing often taking place within non-sterile water. These wash basins then often sit in warehouses as stock, which creates an environment where bacteria can grow and thrive. We here at Angel Guard are changing the standard of manufacture for sanitary ware for use in healthcare environments, with our units being manufactured in a clean environment, dry tested made to order, and packaged in environmentally friendly materials. Angel Guard are also creating a new standard for the installation for our units. Currently, sanitary ware is installed using dirty tools and overalls, having been used in previous plumbing jobs, contaminating the unit and the clinical environment. Angel Guard will be using our own installers, who will be using clean overalls, gloves, and shoe covers with sterilised tools for the installation of each unit, making sure we retain the sterility throughout. Once our units have been installed and commissioned to your specific requirements, we will be monitoring the units 24 hours a day, 7 days a week, maintaining and servicing to ensure the smooth running of your units. Angel Guard will also monitor all alerts and deploy the countermeasures required, creating and providing reports, and providing a personalised, world-class service to all of our customers, with personally assigned guardians and service scientists. By specifying and deciding to fit Angel Guard units, you can play an important part in the war against HCAIs and multi-drug resistant bacteria. Welcome to the future of prevention and protection. We are Angel Guard. Monitor, clean, protect, trust.